preventing the spread of the coronavirus.
One of the things I would recommend is to get your flu shot.
The Pima County Jail's approach to treating addiction.
Probably have access quicker than you and I would maybe on the outside.
Plus, amid ongoing controversy, a first-hand look at controlled blasts at the border wall construction site.
This is the fastest, most efficient way to get it done.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks for joining us. Federal health officials warned this week businesses, hospitals, and communities across the country should prepare for a possible coronavirus outbreak. The Centers for Disease Control and Prevention say the immediate risk remains low, but its ongoing spread around the globe makes the virus harder to contain. We learn more about the concern and what precautions people should take from Michael Warby, an expert in epidemiology at the University of Arizona.
This virus is related not just to human coronaviruses that cause the common cold, but also even more closely related to SARS, which people might remember from 2003, 2004. SARS had a 10% case fatality rate, which is just devastating. This virus has a case fatality rate which is considerably lower than that. We still don't know exactly what it's going to be, but it's probably considerably higher than flu. So if you think about flu killing 80,000 people in a year, this is a really serious thing. And as epidemiologists, we talk about something called the basic reproduction number of a virus. And that is, if your average person gets infected, how many people do they pass the virus on to? And this virus's basic reproduction number looks to be more than 2. So if you think about one person infected, infects 2 people, each of those infects 2 people, in not very long you have thousands and thousands of cases.
It can multiply very quickly.
Yeah.
What can we do? Because many of us in the United States are sort of discounting it. It's not happening here in these mass numbers that it is in other places. So what are those simple steps we can take?
Some of the things we can do actually don't involve this new coronavirus itself. So one of the things I would recommend is to get your flu shot. Again, we have something available for a similar respiratory virus that can protect people. And even if it doesn't directly protect you from landing in the hospital, it may protect the next person in line who might not get infected if you don't have as much virus in your body. So that's one thing that we can do. Another thing is to just think about who's going to be really hard hit by this virus. And what we're seeing is it's hitting elderly people really quite hard. And healthcare workers are always on the front line of outbreaks like this. And so what we should be thinking about is preserving resources and making sure that healthcare workers have what they need. And so it's actually not a great thing to hoard things like face masks, which we don't even know have a protective effect. But it's this balance. It's a serious, serious thing.
One report says that this year's vaccine has been about 45% effective. Is that accurate?
That's accurate, but it's really important to note that that effectiveness is measuring complete protection against infection. And so one way to look at it is glass half full. You're still protecting tens of thousands of people who get the vaccine, even if it's not 100% effective at blocking out infection. But at the same time, that vaccine, even if it doesn't completely block infection, in which case it would be classified as ineffective in that patient, can still make the difference between getting really sick, landing in the hospital with pneumonia and even dying, and just shaking it off and going about your business after feeling a little ill for a couple days.
Okay. Dr. Michael Warby, thank you.
Thank you.
This week, we return to Arizona Public Media's special reporting series, Arizona Addicted. Throughout the country, the Department of Justice reports about 50% of inmates in state and federal custody are battling an addiction. That's true as well at the Pima County Jail. We got an inside look at efforts to tackle the opioid epidemic, even when men and women are behind bars. Every man and woman you see sitting here was recently arrested and is waiting to see a judge. This is intake at the Pima County Jail.
The arresting agency brings them in and takes them to our booking area. They are processed and their personal belongings are taken away. They're entered into the computer system, and then they're seen by an EMT, and then they come into the facility. They are fingerprinted, and then they are seen by a registered nurse.
Seen a Nurse is a somewhat new partnership between Pima County Behavioral Health, the jail, and Centurion, a healthcare provider. A 3-year contract that cost about $50 million.
I think that the level of service has increased greatly. They have access to medical care 24/7 now, and they can be seen almost immediately. As soon as they let us know they have a medical need, it's met much quicker. Years ago, there might have been a couple-day delay before they were seen by a provider or something, and now they're usually seen within the first 24 hours.
As a CO for the last 30 years, have you seen that? Have you experienced that as being on, as a corrections officer and then watching the population, their behavior?
Oh yeah, over my time I've seen medical was a very small piece of our jail at the beginning of my career, and it's a huge piece of what we do now. It's expanded greatly.
That translates into every person getting one-on-one attention from a medical professional. On average, there are about 1,800 inmates housed here. Addressing their needs are more than 100 medical professionals. Some inmates are being treated for addiction. Others are being treated for everything from colds to cancer and heart disease.
The care here at the jail is very good medical care and probably have access quicker than you and I would maybe on the outside.
Linda Everett is a correctional RN who's a program manager with Pima County's Behavioral Health Center.
Actually, they have access to medical care 24 hours, 7 days a week. They can access the care in multiple different ways. They can put in what's called a sick care request, where they ask to be seen for a specific issue. They will be seen within 24 hours by a registered nurse who will do an assessment and then decide what the next step for that person is. They could be moved on to a prescribing provider, an MD, or a psychiatrist if that's the issue, or they can be taken care of if it's within the scope of practice of the registered nurse. Anytime anybody has an emergency, they are seen immediately.
She and her colleagues work alongside correctional officers. Inmate needs are met inside the jail medical services unit, or staff can go directly to cells.
I describe it as pretty significant because a lot of the people here are socially and economically disadvantaged. So you and I may have easy access to medical care because we have health insurance. A lot of these people may not have that same opportunity on the outside. So potentially we could be their only source of medical care and dental and behavioral health.
How's the opiate epidemic really impacted you in your work?
Significantly. Of course, our biggest fear is that they're going to die. And one of the things that because they come into jail and they don't use because they can't, so once they're released, if they're not going to go into treatment, the risk of death from an overdose significantly increases. So one of the things that we would like to we do is we give them education about where to get Narcan and how to use the Narcan.
What about when inmates leave?
If they are in a mental health crisis or they need further mental health evaluation that's a little bit more urgent, we can bring them directly over to the CRC. They are discharged. If they're on medications here, they're discharged with a 7-day supply.
The county recently expanded its medical-assisted treatment program to streamline the process. So when inmates or patients in a system elsewhere, staff here know their history and subsequently their needs.
If somebody is already in service outside on methadone or another medication, we continue their treatment once they're on the inside here. And then once they're released, we bring them back to the program that they were in.
You mentioned when we were talking about how you care about this, how important is it to you that this program has continued to evolve and is making some gains, albeit challenges remain?
We're talking about people's lives. People die from opioid overdoses. Of course, as a nurse, I don't want that. So the program that we're implementing here is we're starting with those who are already in service. Our end goal is to get to actually induct people, to ask them if as they come into our jail, do you want to go into service, and get them on medication.
It's good you starting early to contact.
You see the value in this even once these people leave this building?
Yes, I do, absolutely, because ideally what we'd like to do is improve their life in one manner or another. And if we could save their life after they're released from us, absolutely, that's wonderful. But if we could get them back into services with their mental health providers, that would be great too.
The average stay at the Pima County Jail is 22 days. Captain Sean Stewart is a division commander who oversees operations to include medical services.
Once you get booked into the Pima County Jail, our ultimate goal is to get you to the point where you can function in general population. So 1S is our acutely mentally ill housing unit, where somebody may be decompensating or they're currently psychotic, and we're trying to get them stable. Once we get them to a point where we believe they're stable enough, then we send them to 4 Bravo, which is the step-down unit we're standing in now. And hopefully they continue to improve to the point where we can allow them to be transferred to general population with the rest of the inmates.
Does the Pima County Jail have a position on incarceration versus treatment?
That's a tough question because the jail really doesn't have a piece of that. Basically, if a certified peace officer comes to the Pima County Jail and presents somebody who's been charged with a crime, by statute we have to book them. So they're booked into the jail. And then we will hold them until somebody from the judiciary says to either release them or keep them in custody. So we really don't have a cog in that wheel, so to speak. If our municipalities have a program like that, like they want to defer somebody instead of book them into custody, that's up to the municipalities. It does benefit us. It helps us keep our head counts down. So to that aspect, yes.
Managing inmates as patients requires transparency.
Within that first 24 to 48 hours, it's all based on what they report to us their problems are. And since we're talking about opioids, a lot of times they don't self-report those opioid problems that they're going to have, such as they're asked when they come in, do you believe you're going to go through detoxification? And a lot of times they'll say no, and then we find out later on. But it doesn't matter. Everybody who gets booked in here receives medical care.
Captain Stewart says it's because Pima County is in a metropolitan region and has resources available. One example is in a cell like this one, ideal for an inmate on suicide watch. A bed bolted to the wall that reduces the possibility of an inmate hurting themselves or an officer.
If you're in the mental health unit or if you're in AZ, we'll give you multiple blankets, but you're not going to get sheets because obviously the blankets are harder to tear.
Over the last 10 years or so, the opioid epidemic has increased in Pima County. One study shows that 50% of inmates could have some sort of disorder. Do you see that reflective in your population?
Yeah, I see it reflective in the population, and I also see the difficulties from that population have risen dramatically. A lot of times people come in and they're not just on an opioid addiction, or we have to worry about withdrawals from just opioid. They come in, they're addicted to alcohol, they're addicted to other things, plus the opioids, which compound their medical condition while they're withdrawing.
Back in the medical services unit, Nurse Everett insists caring for this population means effectively responding to needs that exist outside of this facility.
If we can treat their problems here and we can get them into services, we're going to save taxpayers money on the other end. This population is a high utilizer of all of the county services, the hospitals, the EMS units, the CRC. If we can help them here, perhaps we can decrease that overutilization on the outside.
The county is also taking steps to save money and help those struggling with addiction through its Drug Treatment Alternative to Prison program, or DTAP for short. Just as it sounds, DTAP lets defendants with drug-related charges avoid incarceration and enroll in treatment instead. At the Pima County Attorney's Office, we learn more about the program's impact from Chief Deputy Attorney Amelia Kramer.
Well, County Attorney Barbara Lawal has been a visionary in Arizona and is at the forefront of offering treatment instead of prosecution, or if we have to prosecute, instead of jail or prison. And she's helped create a continuum of interventions at each step along the criminal justice process where there's always an off-ramp to treatment.
Tell me about the steps, because there are several.
Covers the gamut. So if someone is arrested for, let's say, shoplifting and trespassing at the Circle K, and he has drugs in his pocket when he's patted down by police, he's not only going to be charged with the low-level misdemeanor of shoplifting and trespassing, but also with felony drug possession, and that's a serious crime. And so one of the things that we have now is the Tucson Police Department, with the blessing of our county attorney, offers deflection. In other words, they can take that person to treatment and deflect them away from the jail. Now, the police will seize the drugs. They're not going to leave someone in possession of illegal drugs. But at the choice of the suspect, rather than take them to jail, they can offer taking them to treatment at Kodak or at Community Bridges, which are two different treatment facilities. The next step is, if there is an arrest made, at that point, after they've been charged with felony drug possession, they have a chance to get out of prosecution. So our office has created a felony drug diversion program where we offer treatment instead of prosecution. And once again, if the participant succeeds, the charges are dismissed and they never have a felony conviction and avoid all of the collateral negative consequences that come along with that. If they happen to fail and they're now going to be prosecuted, when they're convicted under Arizona law, first and second time felony drug possession entitles the person to probation. They will not be sent to prison, which is a good thing. And while they're on probation, our Pima County Probation Department under the Superior Court offers the chance for the person to enter into a drug court where they get treatment and wraparound services and assistance to succeed on probation. If unfortunately they fail that twice, now they would be normally sent to prison in any other county. But our county attorney, Barbara Lawal, back in 2011, created what's called the Drug Treatment Alternative to Prison program. So the individual will have the felony conviction, but he or she has the chance to avoid prison by going to treatment instead. And we have a significant rolling success rate of 65 to 70% at any given time in that program. We've reduced recidivism and turned it on its head. It costs less than half the cost of prison, and we're saving not only the defendant's life, but the lives of their children and their elderly parents and others that they can be there to care for in the community.
You're using words like chances, therapeutic, treatment. Why go through all these measures?
It's the right thing to do, it's the cost-effective thing to do, and it's the way we can attack the opioid epidemic, the meth epidemic, and reduce recidivism in our criminal justice system. So it makes sense all the way around.
You mentioned the opioid epidemic. How has this impacted the caseload?
Well, in Pima County, we have two epidemics. We have both an opioid epidemic and a methamphetamine epidemic. And unfortunately, we have a lot of people who suffer from polysubstance use who are addicted to both and multiple drugs. And some of them suffer also from mental illness. We see police making more and more arrests for drug possession because it's so prevalent in our community. And as you know, we're close to the Mexico border. A lot of these drugs are being imported across the border and brought into the United States through southern Arizona. Well, some of those drugs siphon off of the transportation routes and distribution routes right here into our community in Pima County. And unfortunately, there are a lot of people who try the drugs, get addicted, and then can't stop.
You've been in this office for nearly 20 years. You listed some of the successes. How are you measuring success with programs like this one?
Well, number one, lives saved. You know, when I go to the DTAP and drug court graduation ceremonies, I'm almost always in tears of gratitude to hear the success stories of these individuals who are grateful they got arrested and into the system because it saved their life. So we also are saving others in the community from the victimization that occurs sometimes when people are addicted to drugs. We know from some of our graduates of the DTAP program who never were arrested for burglaries that they committed many, dozens, in some cases hundreds of burglaries and just never got caught. And so they've been victimizing the community as a result of their addiction. Now that they're clean and sober, they have jobs. One of our earliest graduates is a manager at his company, paying taxes and no longer victimizing members of the community. So we think it's a win all the way around.
Diversion programs across Arizona could get a boost from the state. At the legislature, House lawmakers unanimously passed a bill that would give the Arizona Criminal Justice Commission $11.2 million annually for the next 3 spending years. The commission would then allocate those funds to each county attorney's office, with Pima County receiving more than $2 million per year. The bill is now in the Senate. Another bill in the legislature would decriminalize clean needle exchanges, which supporters say would help prevent opioid-related deaths. While a number of states have already done so, not everyone in Arizona is sold on the idea. For Insight, I'm joined by Stephanie Innes, health reporter for the Arizona Republic. Stephanie, thanks for being here.
Thanks for having me.
Let's begin with what is the Clean Needle Exchange program?
Well, a lot of people call it syringe services or sterile or clean needles. And basically, if you are using injectable illicit drugs, often it's heroin, you can go to one of these programs with your dirty needles, and in exchange for, say, 10 dirty ones, they'll give you 10 clean ones. And that cuts down on your risk of skin abscesses, heart infections, and then, of course, bloodborne diseases like HIV and Hep C, which are unfortunately common among injectable drug users.
It's legal and legitimate here in the state of Arizona, correct?
They exist, but they're operating largely under the radar. In Pima County, there is an intergovernmental agreement that allows, and it's actually been in existence since the 1980s, when there were heroin needles around South Tucson. But statewide, it's actually considered distribution of drug paraphernalia, which, syringes or clean needles are drug paraphernalia. So people taking part in these needle exchanges could run a risk of arrest. Now, I have not heard of that happening, but the problem is if they're not legal in the state, then the programs themselves have a hard time getting funding.
What are some of the pros and cons to this argument?
Well, there are a lot of people who, hearing it on the face, a clean needle exchange, you might think, well, that's enabling somebody to use heroin. And it's, one person said normalizing addiction. But if you actually sit down and talk to the people who run the programs, one of the reasons they call it syringe services is because you're not just getting clean needles there. So you're getting referrals to domestic violence, you're getting testing for HIV and Hep C, you get referrals to treatment for addiction if you want it.
As you noted, in places where this does exist, like Pima County, where there's this intergovernmental agreement, any data that show that this has been effective?
Oh yeah, there's decades of data that show that these programs do not increase crime and they cut down on bloodborne diseases, including Hep C and HIV.
What's the argument been at the state legislature for not passing these last few years?
Well, so this is the third year that this has been brought forward. And, I can't really say for sure what it is that's keeping it from passing. It's one of those things where you have to explain it to people for them to understand. And as I said, I understand, it makes sense that on its surface, people might think, well, why would you want to help people get more needles if they're injecting drugs? But the most recent data shows that in 2018, we had 3 people every day in Arizona die of an opioid-induced overdose. It's a lot of people. And the idea is, we don't want you to die with these syringe service programs. We want to meet you where you are. So if all you can do is come in and get a clean needle and not get HIV, okay, and maybe in a few weeks when you come back, you'll want one of these treatment services to be referred to. But I think some of the people feel very judged and they feel bad about themselves, and they're less likely to get help when they feel that way.
If it fails this year, any indication it could be brought up again next year?
I think the people behind this are pretty passionate about it. I don't know if they'll go for another way of doing it. I don't know, but I know that Tony Rivero, he's a Republican from Peoria, he's introduced it every single year. And he says, to him it's not a partisan issue and it's not political, it's just common sense and it's about saving lives.
Okay, Stephanie, thank you.
Thank you.
Now for a follow-up to a story we brought you a few weeks ago about controlled blasts on Oregon Pipe Cactus National Monument, where taller fencing is going up at the border. It made national headlines after the chair of the Tohono O'odham Nation said the blast threatened significant cultural sites. something Customs and Border Protection denies. Both sides spoke out again this week, and the media got a closer look at the detonations.
Fire in the hole!
A fifth round of controlled blast in Oregon Pipe Cactus National Monument went off Wednesday without producing much of a bang, but they have triggered outcry from environmentalists and leaders of the Tohono O'odham Nation. Customs and Border Protection officials say the explosives are necessary to break through solid rock and give crews a better foundation to install 30-foot bollard fencing.
And this is actually less damaging than some of the other ways, and even some of the hydraulic hammers that you can use will not break through some of this, so this is the fastest, most efficient way to get it done.
During this demonstration on Monument Hill,
it is an honor to have been invited to testify before you today.
On Capitol Hill, Tohono O'odham Nation Chairman Ned Norris Jr. appeared at a congressional hearing.
For us, this is no different from DHS building a 30-foot wall along Arlington Cemetery or to the grounds of the National Cathedral.
Norris told the Subcommittee for Indigenous Peoples that the blast sites are on sacred burial grounds. CBP says their own surveys show that is not the case, and that environmental monitors are on the lookout for any cultural artifacts that may turn up. The agency also pushes back against Norris's claim that officials never consulted with the tribe and says talks are ongoing.
This work, particularly the barrier here that's currently existing, that environmental survey work was completed back in 2010 for this. At that time, that was coordinated with the tribe.
This project near the port of entry in Lukeville is one of several happening along the southern border to install taller barriers. Plans here also call for more than 40 new miles of wall that will also include new roads, lights, drainage gates, and animal passages. Crews have completed about 9 miles so far. Protesters gathered on the highway near the border say money and resources spent building the wall should instead go toward immigration reform and clearing the mounting backlog of cases.
If the government would put a little more money into that whole business, instead of building a wall out here, they could just hire people that do bookwork instead of people that are building walls.
Going forward, CBP officials say additional wall projects are likely and that the federal government will handle those sites respectfully.
I think we do a very good job of taking into consideration everywhere we go any cultural impacts to anybody in the area.
But Norris would disagree. He asked Congress to crack down on the Department of Homeland Security's authority to waive environmental laws and put the brakes on future construction.
Preservation of history and culture of O'odham is not just important to the Tohono O'odham Nation, it is important to the preservation of the history and culture of the United States.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360@azpm.org and let us know what you think. We'll see you next week.